Welcome to the Retreat Radio, where we go beyond temporary fixes and surface-level symptom management. Here, we dig into the real root causes behind your symptoms so that you can understand your body, advocate for your health, and ask the right questions. I'm Heather Witt, physician assistant and owner of the Retreat Wellness and Aesthetics. This podcast sits at the intersection of aesthetics, longevity, and functional medicine, and you'll get information without the sugarcoating, the trends, or the nonsense fluff. Let's get into it.
All right, let's get all comfy.
Hi everyone, my name is Heather and welcome back to the Retreat Radio. Val and I have been doing a Q&A. Last week, I'm sure if you tuned in, you saw she asked me a bunch of aesthetic related questions. We decided to get a little bit more cozy and she said she had some more questions for me. So today, what do you have on the agenda?
So we're going to mainly focus on more on the wellness side of our practice. A lot of questions about peptides, of course, our favorite subject, and Ozempic, which is a peptide, but you know what I mean. GLPs, and how I'm kind of seeing this trend of med spas gearing towards the wellness side more.
Yes.
So I want to dive a lot deeper into all of those things.
Oh, and you know I've got some answers for you.
She loves the wellness side, so let's get to it.
Okay.
And like Heather said, if you did not listen to the first part yet, make sure you go back and take a listen because it's good stuff. Okay, let's jump into it. First question.
Hit me.
The Ozempic Face. Ozempic Face, okay? We all heard of this term. Now, do we know if it's caused by the medication directly, or is it caused by rapid weight loss?
So I've said it a million times. I'm going to say it again. Correlation does not equal causation. Okay? Just because somebody is on semaglutide, tirzepatide, Ozempic, whatever you want to call it, a GLP, does not mean that that is going to cause that to happen to you. Yes, it is caused by the medication, but it is caused by an abuse of the medication. So it's caused by an overuse or too rapid of a weight loss while using the medication. So I have a lot of patients that come in who are using it elsewhere. They're getting it from wherever, from their PCP, from a bro at the gym, whatever you may have it.
Bro at the gym,
But surprisingly, these people who are getting it from like their general practitioner, they're getting it prescribed through the pharmacy, through the actual the pens, the ones that are from the FDA, from like Eli Lilly or whatever. And they only come in 4 different strengths. So you cannot be precise with the dosing or move the dosing up or down depending on the patient's symptoms. So they just start with the blanketed lowest pen and they just move up. A lot of places too, like if you're just getting it from the gym or something, people are just doing their own dosing and they are starting way too high. I saw this ad at my gym. I go to Lifetime here in Irvine, and they had this company that was branding themselves there, and they were selling 4 injections of semaglutide, and it was the max dose. And this is good for you for a month. And I'm like, if you are starting somebody on the max dose of semaglutide, they're going to lose way too much weight too quickly. They're going to lose muscle mass. They're probably going to be barfing their brains out.
Oh my God.
They're not going to feel good, and they're going to starve themselves because they're not going to be hungry. And so this is where when you lose that massive amount of weight in too quick of a time span, or you are using this as a magic drug and you're not doing lifestyle changes like you should, and you start losing too much muscle, you are going to get what people are calling the Ozempic face.
Can you also tell listeners what the Ozempic face entails?
So Ozempic face is when somebody goes on something like a GLP, and then over the course of a 5-month period, because they've lost too much weight, their face starts to look gaunt. Mm-hmm. So they actually look older.
Yes.
Which then they're like, this is why else I don't want to go on a GLP, because all my friends did it and they look older. And it's because they did it wrong. And so you lose massive amounts of fat in your face. And when you don't have fat in your face to support the skin structures, everything starts to fall and you look like 10 years older. Mm-hmm. And again, I've said this before, this industry is all based off of marketing and fear mongering and let's use this catchy slogan to get people to talk about it, because exactly everybody's saying Ozempic face, Ozempic face. That's because that was a marketing slogan started to hook people. So this was a way for people to sell Sculptra.
Oh.
I'm not, saying anything bad about Sculptra. I love Sculptra. You guys already know this. We talked about it a lot in part 1. But I don't like how Sculptra is being used and marketed as, now you have to have Sculptra because you're getting a GLP. No, you don't. you should be getting Sculptra for other reasons.
Yeah.
But if you are doing your GLP-1 appropriately, you're being followed correctly, you are making sure you're not losing too much muscle, and you're not losing any more than 1 to 2 pounds a week, yes, you will still likely lose weight in your face, but you're not going to get this Ozempic face. You're not going to get this rapid decline of fat and skin sagging in the face or other parts of the body. And so that is why we're really strict with our programs here, and we do it differently than most.
Yeah, love it.
Okay, I'll get off my soapbox now.
So I just did a post about this recently on our page, but why are women all of a sudden talking so much about creatine, protein, body composition, and it's not just about weight loss anymore, right? The conversation is geared towards that now.
Yeah, so a great example of this is with my weight loss patients. When they come in, they will get on our InBody. So we don't just have a scale here, we use an InBody.
Love the InBody, by the way. It's amazing.
They will come off of it and say, oh, I gained 2 pounds. Oh, this isn't working. Oh, I'm doing everything. And I'm like, whoa. Settle down. Let's open it up and look at it. And I'm like, okay, one thing you need to keep in mind is that muscle weighs more than fat. And when you are on any type of a weight loss program, or just in general, you're working on your body, body composition is more important than total weight loss. And so by body composition, what we mean is we need to be maintaining, if not gaining muscle, and then we want to be losing fat. So if you're losing fat, but still gaining muscle, the scale may not move. Mm-hmm. Or the scale may go up. So in, somebody who maybe is at a healthy weight, they don't need to necessarily lose weight, but they go on like a journey of like building their muscle or like toning up, they likely will see the scale increase. So it's important to get away from just the scale, the number on the scale. It's all about how your body looks, how your clothes are fitting, and how your muscle to fat ratio is looking.
Yeah.
As soon as I explain that to them and then I show them like that they're doing everything right, they're like, oh, okay. And then they're all happy. So I think a lot of, especially women, just get very focused on, they want the scale to say a certain number.
Yeah, because everyone wants to be a certain weight. Mm-hmm. And they're so obsessed with that number on the scale, but that doesn't mean everything.
Right. Weight loss influencers are like, fitness influencers all the time post about this. They'll post a picture of them when they weighed 125 pounds, and then they'll post a picture of them when they weigh 150 pounds. And they always look better in the 150 pound picture because now their body is optimized by their muscle growth. And the other reason why muscle growth is so important is because muscle mass, number one, helps you burn more fat. So the less and less and less muscle you have, the less fat you're going to burn. So it's completely counterintuitive to what you're trying to do on a weight loss program if you're losing muscle.
Is that why some people who go on GLPs, once they stop it, they end up gaining so much of that weight back rapidly?
Yes, because they, first of all, have not put the lifestyle things in place. And second of all, they've completely crashed their metabolism and their insulin sensitivity because they've literally just basically done this all too quickly. And so when they go off of the drug, they don't have that muscle mass to support it. And so they just gain all the weight back. So our patients here who we maintain that muscle mass, they in the long run actually start decreasing their dosage of their GLP-1 because their muscle is burning the fat for them now. So I want to touch a little bit specifically on creatine because even I myself, in the past was really scared of it. So I don't really know how or where that started, but it was always thought that women shouldn't take creatine. It's bad for us. You're going to turn into a man or something like that. At least that's what I always thought. But creatine is something that I like to put pretty much any woman on, especially in those perimenopausal years, because again, the whole point to it is it helps to maintain that muscle mass. And muscle mass is so important for so many things with your health, but especially bone health as you age. And so it's not just a supplement for men anymore. And regardless if you work out or not, creatine is something that you should be taking every day. 1 scoop, it's usually a 5-gram scoop. You can mix it in with anything. It's virtually tasteless. It dissolves really nicely. And it's a super easy way to, keep those muscles healthy.
Why are women with acne, hair growth, irregular cycles, stubborn weight always dismissed until it gets worse?
I feel like they're always dismissed always.
True.
A lot of those things, the cliche is that your general practitioner just says, this is just a part of aging, right? And it is, but it is because your hormones are changing. And the example that I always love to give for this is if a woman goes and she gets hysterectomy and she gets her ovaries taken out as well, what do? They put them on hormones because you now no longer have a hormone producing organ in your body. They removed it. So why is it not the same when, yeah, maybe we're not removing that organ for something, but like it starts failing as we age? Why are we also not replacing hormones for that? And so a lot of these symptoms that you just said are symptoms of declining hormones or hormone shifts in the body throughout the time of aging. And I don't know the answer to this question. This is a question I ask every day. Like, I literally want to go to like general practitioners or OB-GYNs and be like, why are you doing it this way? Especially OB-GYNs. Like, they are supposed to be...
I'm sorry, is that how you pronounce it? OB-GYNs?
OB-GYN.
Oh.
OB-GYN, OB-GYN, because it's a gynecology.
Oh, for a second I was like, what did you call it? I was like, what? And then you said it again, and I said, wait.
Maybe that's just how us healthcare people say it, is OB-GYN.
OB-GYN?
Yeah.
Because I always just hear like OB-GYN. I've never heard
OB-GYN.
OB-GYN.
That's easier.
Yeah.
It's like 2 less syllables. But like, I really don't understand why, if they're supposed to be experts in the female reproductive system, the female cycle, all of that, why are they treating this wrong? And I think that, you know, when I go back to PA school or when I talk to friends in the industry who are doctors, we don't get educated on menopause or perimenopause in school. And I think in med school, if you do, it's like a 20-minute lecture.
Wow.
Right? And it's very like, okay, here's what happens, here's what you do, that's it. So I think that the training is out of date. And a lot of providers, I think, because they're doing so many things, they're not staying up on the research. They're not staying up on the education. Whereas somebody in my industry, it's such a niche industry, I have the time to do that. And so I think that they're just kind of stuck in those old school methods, and they haven't really looked at that WHI study, what it actually showed. They're using the synopsis that the media put into the market, right? They're not looking at what the new studies are showing. And it just boggles my mind, because I think that if I were an OBGYN, like, I would want to give the best quality of life to my patients. And I would be frustrated if I had to continually tell them, this is just aging. You just have to accept it.
Yeah.
Right? On the other hand, you know, you talked about acne and like hair growth. Sometimes that can be a product of too much of certain hormones. So maybe they have an overproduction of androgens or like testosterone. And so again, it's not like, oh, too bad you produce too much, like we're stuck. There are things that we can do for that. It just takes some digging, and it takes thinking outside the box and going away from normal standardized testing levels.
Yeah.
So I don't have an answer for you, because I ask myself that every day, and it's one of the most frustrating parts of my job.
Yeah, it definitely sucks.
Yeah. All the time I get patients that are like, well, I went in and I talked to my GP about this, and he thinks that I shouldn't go on that, and this is so bad. And, you know, or if they are willing to do it for them, they'll put them on like a testosterone cream. I'm like, well, what the hell is that going to do for her?
Yeah.
It's just 2 weeks. So it's just frustrating, because I feel like I'm constantly battling with those providers, and then my patients are confused because they're like, well, who should I listen to?
Yeah, it's very confusing, I think. And that's why there's so many conflicting arguments all the time with everything in this industry.
Yeah. Frustrating.
It is. It truly is. Do you think med spas are now becoming mini wellness clinics?
You know me so well.
And do you think that's a good thing, or is it a red flag?
So I actually planned to have a whole podcast kind of on this subject and just the med spa industry as a whole. But yes, I mean, we can obviously see every single med spa out there is now one by one. Oh, we offer wellness now. Oh, we offer wellness now. Oh, I'm so excited we're bringing GLPs into our practice. And it's a bandwagon thing. Everybody's jumping on it. And in some sense, I feel like it's a good thing, because it means people are paying attention and they're seeing what the competition is doing. And then if they want to stay relevant to what's going on, they need to be looking into these things. My problem with it is that if you are going to be starting to offer new services at your clinic, or you're going to be diving into offering weight loss programs, hormone therapy, what have you, you cannot just add it to your menu like you're adding a new filler, or that, we just brought on this new laser and you just add it to your menu. This is not a menu item you just add on.
Yeah.
This is more on the realm of real medicine as compared to something like aesthetics, which it still is real medicine, but it is a little bit more niche, right? So with something like this, there are major contraindications. There are major interactions. There are major rules when you are doing some of these things, and there is a proper way to do it, and there's a dangerous way to do it. And if you're not taking the time to fully educate yourself on all of this and what it entails, then I feel like you are being reckless. And in my opinion, this is malpractice. So just offering semaglutide in your practice and putting everybody on it like it's a piece of candy and not running labs, not monitoring muscle mass and investing in something like an InBody, not having monthly follow-ups. This takes time on my schedule. I'm following up with these people monthly and making sure that they're doing the right thing. I'm giving them lifestyle education. I'm giving them nutrition and exercise coaching. Like, this is a full branch of medicine that you are adding to your practice. And so I feel like it is getting a little bit out of hand because we have polluted the aesthetic environment by people just opening med spas left and right with no education and no experience. And now I feel like the same thing is happening with the wellness industry. And we're also having non-medical people opening things, and they're providing these GLPs, they're providing these wellness services, and they're not even medically licensed. So I think it's becoming oversaturated and dangerous for patients because they don't know where to go and they don't know who to listen to.
Right.
And somebody like me, yes, I own a med spa and now I offer these services, but I don't want to be lumped in a category with everybody else where I just willy-nilly added this onto my menu. I researched and trained in this for over a year before I even started bringing it onto my practice. So that's my 2 cents on that. Like I said, I'll have a whole podcast episode on this, but I think there needs to be a little bit more education and control over these types of services that people are offering.
Are there certain red flags that you would like to point out that you see certain clinics becoming more of these cash grab places versus actually educating and working with patients?
First of all, if you're not seeing a medical provider, absolutely not.
Now, is that
red flag?
Is that every single medical provider, or are there ones that can give peptides and ones that can't?
Good point. That's actually a good point. I didn't think to mention that. These are medications, right? They need a prescription. We call these into pharmacies. We call these into compound pharmacies. They require a patient-specific prescription. If you are a nurse, you cannot be prescribing. So a lot of clinics do it in a sense of the nurse sees you, but they have their supervising physician or a PA or an NP in the back that actually does the prescriptions. But technically a nurse should not be advising you on something like this. They can be procedure nurses, so they can be inserting pellets or showing you how to drop the medications or giving you the medications or things like that, but they should not be interpreting your labs and determining what medications you should go on and determining your dosages. So I do think in the realm of functional medicine and wellness, you likely should not be seeing a nurse.
Unless they are a nurse practitioner.
Correct. They should be licensed to prescribe, diagnose, and treat. You should not be getting any of this from anybody who's not a medical provider. So this is your friend who's selling peptides like it's Avon. Is that what that company was called? Avon or Tupperware?
Or Mary Kay.
Yeah. So that is a no-no. And then if you are going to a clinic where all they do is GLPs, that's a red flag. You can go get your GLP there, but if that's all they're offering, and then all their aesthetic services, they probably haven't done the research to really know the science behind how GLPs can really work and what to look out for and how to truly optimize your weight loss to the best of its ability. So I think that those are the biggest things to look for. Or a med spa that's they're just offering other peptides and that's it. And there's no workup to it. They don't have you fill out an extensive medical history. They don't do labs. They don't have special devices to be measuring your muscle and your fat mass, and they're just basically asking you how much you weigh on your scale at home. Those are all major red flags you want to look out for.
Got it. What is one trend in either aesthetics or wellness that is being used a lot, and it sounds advanced, but there's not really that much clinical thought behind it?
That's a good question. I'll give you one from each.
Okay.
So from aesthetics, I would say exosomes.
Yep, good one.
I think it's a buzzword. It's a marketing word. We use exosomes here, but what's really important to understand about the science of exosomes is that they cannot just penetrate the skin. So we talked about some of this in part 1 with topicals and things, but it needs an entry way to get in. So it needs an actual microneedling hole, from the needles going in and out, or it needs some type of an advanced system that can carry or deliver that exosome into the skin, which there are companies out there that say that they have that. I don't really know. But so at the end of the day, all of these products that come out, I'm not to say that we don't use them, but we don't use them because they're an exosome. We use them because of the cocktail of growth factors that are in there. Mm-hmm. So a great example of this, and I'm going to call out some brands here.
Oh, okay. But she's about to, okay.
A great example of this is Plated. Plated is huge in the industry right now.
Yeah.
And injectors left and right are jumping on it because so-and-so has it and so-and-so says it's so great, but nobody's actually doing the research on it. Plated works. Yes, it is a great product. People are getting great results, and they stand behind that by saying, well, explain to me why my patients get good results then. Your patients are getting good results not because there's an exosome in there. There's likely 0 intact exosomes in there because it is also extremely difficult to make a shelf-stable exosome. What is in there that is creating these amazing results for your patients are the growth factors, which is basically the end result of what exosomes can sometimes give off. And all the other like filler ingredients that are in there. So whatever they're using as their, hydrator that's in there, or like some of them have hyaluronic acid and stuff in them. So that is what is creating the results. So I'm not saying that the product itself is bad, but trying to stand behind this marketing of like, oh, we use exosomes here at our practice. Well, that literally means nothing. And most of the exosome serums out there that these companies are selling are shit. Now, we do use exosomes with our advanced biologics or our advanced, like our birth tissue biologics. And those are true exosomes that are harvested from like umbilical cord tissue, from amniotic fluid. And they need to be kept in a special freezer at a certain temperature to maintain the livelihood of them. And then we're actually injecting them into the patient to actually get them through that skin barrier. So I think that exosomes sound fancy, but most providers don't actually understand them or what they are or what's actually in their products that are making a result.
You said you're going to call out brands earlier.
I called out Plated.
Oh, just Plated? I thought there would be more than one brand.
I mean, like even the products that we use, they are marketed to us as exosome serums, but that's not why we use them. We use them because I like their growth factor profile that's in there. Or like the one we use for microneedling also has PRN in it. And I like that for, post-care healing. So it's important to know what is in the product and why you're actually using it.
How about on the wellness side? You said you had one for that too.
So as far as wellness goes, I would say it would be peptide stacks.
Ooh, yeah. I've seen a lot of that online.
Yeah. So
it's like, how is that possible? Like, that's a lot.
So, I mean, like I said, peptides are great. I love peptides. And I even talk about peptide stacks. But what I'm seeing online is these people they're on like 7 different peptides. And that's just way too many at once. First of all, I don't even know how you're poking yourself that much. Like, talk about like needle fatigue.
Yeah.
So the way that you should really be looking at peptides is you're looking to optimize something, right? And there are lots and lots of different peptides, and they each target a certain thing. So what I like to do is I like to do 2 to at max 3 peptides at a time. And I like to choose peptides that work well together. And I like to target something specific. So with a lot of people, what I start with is like reducing inflammation. Reduce inflammation in the body so that then your other peptides can work well. So I start a lot of people on like BPC 157, maybe add in some TB4, TB500, and maybe add in like a growth hormone secretagogue as well, like a CJC ipamorelin. So like I'll start with that. And you do that for like 3 months, 10 weeks to 12 weeks. And then you need to take a break from those peptides. That's the other thing I see is people staying on peptides long term, the same peptide. You need to give yourself breaks and cycles so that your receptors don't become fatigued. So then once you're done with those, okay, now maybe we're focusing on immune health. So maybe we talk about like some thymosin alpha. Maybe we talk about epitalin for reducing your biological age that we talked about. And then maybe when we're done with that stack, then we're talking about like optimizing like our muscle function. So we're talking about some of those growth hormone analogs. And that's kind of how you march your way through it on what specifically you want to treat. And that way you can also design it that if you always get sick in the fall, or you're always stressed like around tax time because you're a tax accountant, there are specific peptides that we can use to target that specifically at that time of year. But doing like 7 of them all at once and probably staying on them for more than 6 months at a time, you're completely missing the point, and a lot of them can interact with each other. So you're probably not even getting the benefits of most of them when you're doing that.
Interesting. So I know you said that you need to go on it and then give yourself a break. Does that also apply for GLP-1s?
No, so typically GLP-1s, I mean, we're constantly changing it up we're changing the dose.
Oh, I see.
So usually like every 4 weeks or so, we're changing the dose. And for me, at least with my patients, once I kind of march them up and they get to a good spot, a lot of times because they're doing so well with their muscle mass, we're able to also start titrating them down as they continue to lose their weight. And then we keep them on more of like a metabolic dose, like to help with their metabolic health. But yes, even with that, you can stay on it for longer than 3 months, but even when you're on those like microdoses, you should give yourself some breaks from those every once in a while.
All right, everyone. So those are all of my questions for today.
Those are some good ones.
I know they were I had to think about it. But I'm really glad that you were all able to join us for it. I hope you guys picked up on a couple of things because I know I sure picked up on a lot of things today. I was definitely learning a lot of stuff.
Yeah, it seems like you guys really like these more relaxed kind of like Q&A style. So if you guys ever have like a burning question that you want answered, email us, DM us, get a hold of us somehow, because I like to collect them over time. And then that way we can sit down and do these every once in a while and get your best questions answered.
Yeah, Heather is an open book, and that's what I love about her. She is very knowledgeable and she makes things easy to understand.
I hope so. I'll try. But, well, thank you for joining us today. I'm looking forward to seeing all you guys on our next episode. Until then, have a great rest of your day.
See ya. Bye.
The information shared on this podcast is for educational purposes only. It reflects clinical experience and opinion and is not intended to serve as a diagnosis, treatment plan, or medical advice. As always, please consult with a qualified healthcare provider before making any changes to your health, medications, or treatment plan. If you want to be a part of our community, make sure to follow us on Instagram at theretreat.wellness and theretreat.aesthetics. Thank you so much for spending part of your day with me today, and until next time.